What to do if your cat fell from a high place? Cats are known for their agility and ability to land on their feet, thanks to their righting reflex. However, this does not mean they are immune to injuries from falls. If your cat has fallen from a high place, such as a balcony, window, or rooftop, it is crucial to act quickly to assess their condition and provide proper care. Even if they seem fine, internal injuries may not be immediately visible. Step 1. Stay calm and approach carefully. A fall can leave a cat scared, disoriented, or in pain. If they are conscious but in distress, they may try to hide or lash out. Do not panic, your cat needs your calm presence. Move slowly and speak gently to avoid frightening them further. If the cat appears aggressive or is trying to escape, give them a moment to settle before attempting to pick them up. Step 2. Assess for visible injuries. Check your cat for any immediate signs of injury. Have a checkmark breathing issues. If your cat is struggling to breathe, breathing rapidly, or making wheezing sounds, they may have suffered chest trauma or lung damage. Have a checkmark bleeding. Look for any external wounds, especially around the mouth, nose, or paws. Have a checkmark broken bones. A limping cat or one refusing to put weight on a leg may have a fracture. Have a checkmark swollen abdomen. Internal bleeding could cause a bloated belly or tenderness when touched. Have a checkmark unconsciousness or seizures. These signs indicate severe head trauma and require immediate emergency care. Even if your cat appears fine, monitor them closely for any delayed symptoms. Some injuries, such as internal bleeding or head trauma, may take hours or days to manifest. Step 3. Limit movement and provide immediate first aid. If your cat is injured, do not let them move too much to prevent worsening any potential fractures or spinal injuries. Place them in a comfortable position, ideally on a flat, firm surface like a towel or blanket. Keep them warm and calm by speaking softly and avoiding sudden movements. If there is bleeding, apply gentle pressure with a clean cloth to slow it down. Step 4. Transport your cat to the vet immediately. Regardless of whether your cat shows obvious injuries, you should take them to a veterinarian as soon as possible. Cats are good at hiding pain, and internal injuries can be life-threatening if untreated. Have a checkmark use a carrier or a sturdy box with a soft blanket to transport your cat safely. Have a checkmark drive carefully to avoid unnecessary movement that could worsen injuries. Have a checkmark explain the situation to the vet and provide details about the height of the fall and any symptoms you noticed. Step 5. Monitor recovery at home. If your vet determines that your cat has minor injuries and can recover at home, have a checkmark provide a quiet and comfortable space where they can rest without stress. Have a checkmark follow the vet's instructions, including pain medication, wound care, or restricted movement. Have a checkmark keep an eye on their eating and drinking habits. If they stop eating or drinking, return to the vet. Have a checkmark limit jumping and climbing to prevent further injuries during recovery. Preventing future falls. To avoid accidents in the future, have a checkmark install window screens or safety nets to prevent cats from falling. Have a checkmark keep balconies and high surfaces secured so your cat cannot slip through gaps. Have a checkmark provide safe climbing alternatives, such as cat trees or shelves, to satisfy their climbing instincts. Have a checkmark supervise outdoor time and never leave cats unattended on high ledges. While cats have remarkable survival instincts, a high fall can still result in serious injury. Taking the right steps immediately after a fall can make a significant difference in your cat's recovery and long-term health.